I'm Charlie Dunnett, clinical lead for Wigtownshire and a GP in Newton Stewart.
I'm MacFazdean, I'm Head of Ambulance Services for Dumfries and Galloway.
This is a 6-month pilot project where we are using paramedics to help the practice with their house visiting. The basis behind that is to determine whether or not it's a good model of care for patients and for the service to make use of their skills in assessing people in the house.
Very much our approach in Dumfries and Galloway has been to try and integrate as much as possible with NHS and Dumfries and Galloway for the benefit of the patients that we all serve.
So there will be each week one paramedic attached to our practice, which is Galloway Hills Medical Group. We'll also be attached 2 days a week to the Southern Macca's practice, which is based out of Whithorn and Port William. They will be working alongside and under the supervision of the general practitioners. And when a house call request comes in, the GP will decide if that's an appropriate house call for the paramedic. If it is, then the paramedic will be dispatched to go and make an assessment, and they will then feed that back to the GP. He will then decide what medication needs to be prescribed. If it's felt that a GP needs to visit as well, then the GP will go out afterwards. And if the paramedic feels that actually admission is required, the paramedic will admit the patient direct to hospital, having discussed it first of all with the GP. I think it's important to stress that if it's a palliative care type house call or a house call that we feel is inappropriate for a paramedic, then the GP will still be visited.
And the long-term view is if this pilot is successful and it rolls out across Dumfries and Galloway area, we hope to see the long-term benefit of a reduction in calls to us due to the pressures that are currently on GP practices that may well lead members of the public to phone 999.
So we know from models elsewhere, so Inverclyde have been doing this now for over a year. Areas of the borders, and they also use paramedics in-house visiting in different ways on scheduled care. So it is a pilot for 6 months. During that time we will be evaluating how successful it's been in terms of how many calls were suitable for paramedics, to allow us to determine what the staffing level might be. We'll also be assessing patients' views of it by doing a patient satisfaction survey as well to ensure that patients are happy with it. The aim is that if we can show that it's a valuable use of a resource, it's safe and patients like it, then we will hopefully be able to develop a model into a more permanent arrangement over time.
Yeah, certainly the 3 paramedics that are currently involved in this pilot have been given very good feedback, and they feel they've been received very well and getting good mentorship from Charlie and his colleagues for the pilot scheme. So it's all very positive for the paramedics themselves.
Already we've seen a few times each week visits that have been coming in late or urgent, and we've been able to dispatch the paramedics down to those, which has been fantastic for the patients, but also the practice, and the patients who've seen them have all been very happy with what they've done. So far it's early days, but we're delighted at how it's going.